Hello, I'm Dr. Victor Liu. I'm a plastic surgeon in Burlingame, California. Today we'll be talking about hair restoration. Now, there are two main ways of hair restoration. One is non-surgical and one is surgical. Now, the non-surgical ones make use of the fact that a lot of people, after they lose hair, the hair follicles are still present. So that when you stimulate those hair follicles, it will grow new hair. Now, the way we do it, there are several ways. One is using simple PRP, and then the other ways are using stem cells. The simple PRP works to a certain extent, but not as well as the stem cells. Now, the stem cells could be from different sources. It could be from your own body using the fat stem cells, or we can use the bone marrow stem cells. Or you can use stem cells from another person. Normally, a newborn baby, when they have a placenta, you use the placental blood to obtain the stem cells. Then there is another way of doing it is using a derivative or a product of stem cells, which are called exosomes. These do not contain any stem cells, but the product of stem cells. Now, all these are very useful, and the way we do it is just to inject the stem cells into the skin, the scalp rather, where the hair follicles are. And then the hair follicles will be stimulated by the stem cells and will start to grow hair. Now, just as an example, you see this lady, by the way, for ladies, they lose hair very diffusely. They lose hair all over the scalp and not just parts of it, as opposed to men. When they lose hair, it will be certain parts of the scalp. So in a lady, it's more difficult to do hair grafts because there's so many areas. So stem cell treatment is very ideal. If you look at this lady on the left side, is before treatment. There's some scarcity of hair, but then it's very deceiving because this, although it's very little hair loss, but it's all over the place, so that you add it all together, it's a lot of hair loss. So on the right side is this, you can see some improvement, and that improvement is all over the scalp. This is another patient who has hair loss, as you can see on the left side, rather diffusely, and then on the right side is about 6-7 months after the injection of the stem cells. And as you can see, this works extremely well. There's no surgery involved, and the hair grows normally. It's like normal hair, and you have to cut it, and you can trim it. You can do anything you want with it. Now, the other way to restore hair is by hair grafting. The hair grafting, there are several ways of doing it, and I'm going to show this video which shows you the different ways.
NeoGraft was founded with the belief and dedication that persons suffering from hair loss deserve the safest and most advanced treatment available. Hair restoration should be undetectable and look absolutely natural. Traditional strip harvesting involves a large skin incision on the back of the patient's head to remove a section of scalp. This section of scalp is used as a source of follicles to be implanted in a new location of the patient's scalp. As seen in the animation, this method leaves a permanent linear scar as the two edges of scalp are joined together. This donor scar can be a significant source of embarrassment for patients. NeoGraft provides a minimally invasive option, leaving no linear scar. Using the same area of scalp in the back of the patient's head, a certified NeoGraft provider carefully extracts follicles individually, instead of strip harvesting, and the scalp remains intact. The grafts are removed with a gentle process and collected pneumatically. Within a week, the donor area will be healed, look completely normal, and the hair will not look thinner. Once the desired quantity of follicles is collected, the NeoGraft no-touch follicle implantation method is implemented. This process involves careful placement of the follicles into the scalp area using a safe and simple delivery technique. Implantation continues until all of the harvested follicles have been transplanted. The newly transplanted follicles will rest and then regrow perfectly natural hair in the newly grafted areas. The result is a natural-appearing, more full head of hair. The new hair can be colored, cut, or styled in any fashion. There is no unsightly linear scar, and the procedure is completely undetectable. other than the new hair growth, of course.
So you can see that there are two main ways of doing hair transplantation. One is the strip method, in which we take a strip of scalp from the back of the scalp, and then we close that defect, and then from the strip we take out all the isolate different follicles, and then use that for transplantation. The NeoGraft technique does not require that. The NeoGraft technique have to shave the back of the scalp and then use the NeoGraft machine to take hair follicles one at a time. And there is very little discomfort, and there is no deformity, and there's absolutely no scarring. So that's the biggest advantage of the NeoGraft technique. There are other advantages which I'm going to show you. Now, the NeoGraft process is simple. The one on the left upper corner shows the design of the new hairline, and then the one right to it shows the area of the scalp that you shave off, and then on the right side it shows the actual process of removing the hair follicles using the NeoGraft machine. Then the left lower one shows the actual follicles and hair that was removed, and you can see it is very even. The hair graft contains of 1 to 4 follicles. That means 1 to 4 hair can grow from each. So typically what we do is we put the 1 hair one in the front and the 4 hair ones on the back, so that it looks very natural. The next picture shows the design of the hairline, and then the one on the right of it shows the actual placement of those grafts. Now this is just a picture of the handpiece that we use for the NeoGraft machine. On the left side is the area where we used to take out the follicles, and on the right side you see the cylinder there. That's where we collect the grafts. Now, what is a big difference also in the quality of the graft obtained? On the left side shows the NeoGraft auto extraction technique. You can see that the grafts are very uniform, and they're well protected with some fat around it, and these are very good looking grafts. On the right side is the strip technique, and use manually to take each of those follicles from that strip. And it is very difficult to get consistency and evenness, and you can see that the graft does not look as nice, and some of the hair follicles in fact are exposed, and that is not good. This picture shows the graft immediately after insertion, and this one shows the finished product. Now this is at the day of surgery when this is finished already. And this shows the appearance of it 3 days afterwards. You see some dark color, and these are just scabs which will fall within a couple of days. Now you notice that there's very little swelling and very little bruising, and the patient can really go back to work after 1 or 2 days. Now this is an example of such a procedure. On the left side is preoperatively, and then the right side is after surgery, and you can see that the grafts are very robust and very strong, and you cannot tell that these are skin grafts, and this looks actually like normal hair. And this is good because this patient has very good donor hair. Sometimes it's not as good as this. When the hair is too fine, then we don't get such a richly applied hair. And this one shows more diffuse loss of hair, and then and the one on the right is after grafting. Now it's not very thick, but it's much better than before, and the limitation of this is the number of donor grafts. And this again, this is probably the most common type of hair transplantation that we do. We do the hair grafts, probably about 1,500 to 2,000 hair grafts in this case. And it's a similar one. If you look at the the hairline, it really looks normal, does not look like it's grafting. And this is another case that we just improved the hairline a little bit. And this again is more diffuse, and we just an improvement and not meant to be a dense hair growth. And then this, of course, is the beginning of losing hair in the crown, and then afterwards you have a coverage. Now, the hair loss mostly are genetic, but sometimes it's man-made or other causes. And in this particular patient, she had a brow lift done in Asia, and in Asia they typically do brow lift with the incision just above the eyebrow. And this is a no-no as far as I'm concerned, because the scar is usually very difficult to hide, and also you can have hair loss, like in this case. So she came to me, and then we did a hair transplantation to reconstruct the eyebrows. And this one had a laceration when she was a young child, and then you have a scar and loss of eyebrow in this area. And after hair grafting, this looks normal. One thing I'd like to let you know is the hair graft that is put on the recipient area do not fall off. Normally, when patients continue to have hair loss, when patients continue to have hair loss, the existing hair will drop off, whereas the grafted hair behave still the same as if it were in the donor area and will not fall off. So that's one of the biggest advantage. And then, of course, when it is taken, it's like normal hair. You have to cut it, you can trim it, you can dye it, you can do anything you want with it. So essentially, there are two main ways of doing it. One is a non-surgical, which is use stem cells, and the other one is the hair grafting. So if you have any more questions, feel free to call us. My number is 650-697-8888, and I'll try to call you back as soon as I can. And if not, just come in for a consultation. The consultation will be free if you mention that you have seen me on this video. And thank you.